BAX-U. So we're going to talk about neck pain today. My name is Dr. Romina Ghassemi, and I specifically wanted to have this topic because working from home has been a challenge for a lot of us. So coming from a comfortable ergonomic workspace, we are moving from the bed to the couch, to the coffee table, to the dining table, kitchen counter, and finding that comfort and overloading of the body can cause problems. So let's learn about what is neck pain, why do we have it, and how we can solve this problem as naturally as possible. My name is Dr. Romina. I'm the founder of Think Healthy. My clinic is on Venice and Robertson. If you're familiar with that, it's in LA, Culver City County, Culver City area. And I am also an innovator, speaker, researcher. So I'm passionate about what I do. And my goal is to help people have a better life, at least during my shift in my lifetime. So here we go. Hopefully this will be of benefit to you. So what is neck pain? So there's different types of neck pain. It could be sharp, it could be deep, dull, achy. The pain may go to your head. So if it starts in the middle of your neck or starts anywhere around your neck, it has the ability to progress, affect above and below. So it usually is accompanied by muscle spasm to the upper back, neck, and head and shoulder area. So typical symptoms of neck pain are dizziness, even fever. You might experience that with certain headaches, cervicogenic headaches, which means that the problem starts in the neck and moves up to your head. Don't be surprised if you get night sweats, blurred vision. Anybody suffering from allergies and asthma who has a forward head carriage would also benefit from this 30 minutes that we're going to discuss. It's a 30 minutes of wellness. That's all it's about. And I hope that I could be of benefit to you. Neck pain has become more common. Almost 65% of the working adults are suffering from neck pain, whereas about 20 years ago, that was low back pain. So we're having a higher incidence of neck pain and headache. And not only we're having a higher incidence of reported neck pain, but also we're getting them into a younger generation rather than older generation. And why would you think that is? Anybody has a smartphone? That could be a good reason. So types of neck pain. Neck pain, you have muscle pain, you have muscle spasm or stiffness or tightness. You get headaches, that's also caused by neck pain. You have facet joint problem, and it also can affect your TMJ, it can affect your jaw, can affect your hearing, as if the masks are not doing that enough. And it could also be a pinched nerve that radiates down to your arm or fingers. So you might think you have carpal tunnel syndrome, but just backtrack and see if it could be coming from the neck. So in your neck, you have 7 bones that sit on top of each other like a stack of Legos. They're separated by a soft tissue, also known as the disc. The disc is composed of 2 parts, a more rigid part, which we call annulus fibrosus, and a softer gelatinous structure in the middle, which is called nucleus pulposus. The nucleus pulposus is very similar to, if I was to give an example, it's very much like a jelly donut. The jelly in the middle is the actual disc itself that gets protruded, right? So if you take a nice, juicy, delicious jelly donut full and you squeeze it down, the jelly squirts out in different directions, either to the sides, to the front, to the back, depending on the forces that is being placed on, how that loading is going to be applied. For people with forward head carriage, for people who have rounded shoulders and forward head position, this tends to cause the loading more on the back of the jelly donut, and the jelly or the nucleus pulposus moves into forward and sideways, what we call anterior lateral. This can pinch the nerves that are exiting from the IVF, also known as intervertebral foramen, and that will cause nerve pinch, all right? So it starts with a localized pain and it progresses to a nerve pinch, which progresses into wear and tear into the discs, progresses into wear and tear into the soft tissue, into the hard tissue, which is the vertebrae, also known as degenerative joint disease. The pain pattern, depending on what level is being affected, is as shown in this picture. So if you have a nerve pinch in your C5, C6, then you really are experiencing a lot of neck and shoulder problem, thinking it's a shoulder pain, but it really could be from a neck. An MRI would be very beneficial for that. If you're experiencing more of a suboccipital headaches, you're looking at the upper cervical, which also compromises your immune system. So you have to be very careful about that. If you're experiencing any numbness and tingling in your fingers, or if you're experiencing more of a scapular area, you're looking at the lower part of your neck at the junction between the neck and the shoulder area. So let's talk about what kind of pain you're getting in a neck pain. You could either have acute pain, which happens all of a sudden and is severe and is uncomfortable, or you could have chronic pain that's been going on for a while. So what's the difference? Let's talk about that. Acute pain usually sponsors as a result of an injury. So this could be sports injury, motor vehicle accident, work injury, waking up with a stiff neck, or it could be chronic, right? Chronic starts usually as a gradual pain. So you did wake up with that stiff neck and you thought, okay, you know, it's going to go away, or you're going to look like that guy, right? So you compromise and you compensate throughout the day. And then guess what? It keeps going on. A couple of ibuprofens, a couple of heat packs, ice packs, stretch, massage. But this has been lingering and lingering, and it comes and goes and comes and goes. But every time it comes back a little bit stronger, a little bit harder, and happens a little bit too often. For that reason, it's very important to know that you're suffering from chronic pain. And the pain is classified as chronic when it's over 3 months and it still comes back. You definitely want to find the underlying cause. So the pattern of a pain cycle is very important for you to know, because pain does cause depression. It does cause anxiety. It does cause aggravation it affects your mind. That we call psychosomatic pain. And psychosomatic pain or somatopsychic pain is when the pain and the physical body are related to each other. So don't be surprised that changing the status or changing your physiology can have an impact on your mood. For those of you who are suffering from mental depression or mental problems, that you feel like you're not your 100% mentally, know that addressing the pain is going to be an absolute right step to the right path of being wellness, of being healthy. So let's talk about acute pain. So acute pain, which where usually most of the problems start there, especially those of you who've been in a car accident, please, 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 please make sure your doctor takes a flexion extension view from you. Why? Because if there is whiplash causes acute injury to the ligaments and the tendons, and that sudden shift can actually cause tearing, microtrauma tears, which affects the position of the vertebra. So if the bones are sitting on top of each other and you get into a whiplash and the bones are what stabilizes these bones is torn. When you move your head up and down, they shift. And that shifting would cause chronic neck problem, which is pretty damaging. So you don't want to be there. But it's easily identified if your doctor takes a flexion extension view. So that's a little big hint that I could share with you. Carrying heavy bags, one-sided on the shoulder. For those of ladies who carry heavy bags on one side or holding it here, you tend to elevate your shoulder and have your head forward. That's one. Heavy bags that you carry in the groceries or other factors that you do. Sleeping with terrible pillows or sleeping in an awkward position. Or let's say you are sleeping in a good position, but throughout the day, you spend 80% of your time with your head down or in a poor ergonomic position. Those are the factors that cause acute pain where you wake up with pain. It usually begins suddenly. It can be excruciating or could be dull. It's typically followed with stiffness and difficulty to turn your head. So your motion is absolutely interrupted. So muscle spasm, reduced range of motion. Those are the acute problem. Then we have neck pain, which is chronic neck pain. So remember I was telling you about the bones and the disc in the between? Those are the discs in between. And you remember I told you about the nerves that exit? As the nerves exit, your neck is the last pathway to your command center, which is your brain. So any effect or any positioning of changing in this tunnel structure where the nerves are flowing will affect the information feeding to your brain, and which is the command center. So if the responses are different, don't be surprised. But we just need to fix that tunnel, okay? So it's related to typically medical conditions such as degenerative joint disease, but you didn't wake up with arthritis, you didn't wake up with disc problem, you didn't wake up with degenerative joint disease, you progressed it a while back. People with scoliosis have also a higher chances of neck problem. Why? Because that's where the biomechanic of the body is shifted. So that tunnel we were talking about, that tunnel is shifted from way back there, and the neck is only compensating for it. Sometimes an extension acute can cause an acute pain that becomes chronic. It's typically dull and achy, and it's typically accomplished by depression. Can I ask you a question? And would you think about this? Look at our children. Our Gen Z are the first of all the generations that are solely raised in a technology environment from beginning, from birth. Having our children with poor posture is what is the problem that we will face in the future. So please, if you have a child, or if you know of a child, or if you see a child, and that is anywhere from the age of 8 until 23. So when I talk about child, I'm talking about Gen Z, which is 10 to 23 at this point. Please take proactive actions in getting that smartphone properly positioned. Use the voice activation so there's less forward head carriage. Don't be surprised having mental health issues in our young adults. That is very much related to physical problems because pain causes depression. A child typically does not complain of pain. They act it out. An adult complains of pain because the structures are too rigid to adapt. So they go through a resistance of adaptation. The children are growing with poor posture. So please take this matter into an absolute importance. What you're doing for your child today, or what you're doing for your nieces and nephews and your loved ones, and what doctors are doing for their young patients is of extreme benefit to 10, 20, 30 years from now, when maybe I'm not around, but hopefully this message can come to you and you can make a difference. So here we go. Why do people get neck pain? So posture is the #1 factor, sleeping in awkward position, repetitive movements. So if you are a cashier at a grocery store, if you are a dentist, dental hygienist that is twisted their head with their jaw position, if you're a programmer, blogger, or you're an attorney or an accountant and then sitting poorly on your computer, those are the factors you need to address. Your chronic repetitive stress injury will cause an acute problem in your neck. So let me tell you what exactly about posture we're talking about. You see the big circle here? That is around your earlobe. You see that little circle? That's your middle of your shoulder. Normal posture and normal biomechanics, which is about this guy, right? You see that? Or in this picture, in the green figure, if you look at the x-ray, the curve of the neck is almost like a crescent moon. It's important to have that. Your head weighs about 8 to 15 pounds. So imagine you took a bowling ball and you held the bowling ball. And how you hold the bowling ball is the most comfortable in this position. You're not going to hold the bowling ball like that, are you? So a typical comfortable bowling ball hold is like this. This curve is equivalent to the curve in your neck. So if you have a straight neck, like the second picture here on the x-ray, you're going to be overloading the upper back and neck muscles by about 10 to 12 pounds. So you're carrying a sack of potatoes or a heavy weight of 10 to 12 pounds on your shoulders 24/7, whether you're sleeping or whether you're standing or sitting, or even if you're even at an ergonomically positioned desk, or if you're working out, even worse than that, if you're working out. Now, that affects your lower back 3 times more. So it's almost like a lever system. If I change the position of my hand holding the bowling ball into a straight position, where do you think the compensation comes from? The compensation comes from the lower part, which is farther away, and that would be the lower back. So for those of you who've been sitting at a desk and technically don't have much of an upper back and neck pain, but you do have lower back pain, that's because of that problem. So common problems of your neck, the chronic problems are degenerative disc problem in your neck, degenerative disc problem. And also, sorry, I just got a text message that distracted me. Okay, it will cause you wear and tear. So this phase 1, moving into phase 2, is when the bones have stopped holding on as hard as they can, and the structure biomechanically is wearing and tearing, and you move into phase 2 of postural degeneration, also known as degenerative joint disease. Cervical means neck. Degenerative is pretty self-explanatory. It's degenerating the discs, it's wearing and tearing the discs, and it's becoming a disease process, which means it has a series of symptoms and problems. If you have osteoarthritis, osteoarthritis is osteo means bone, and arthro means joint, and itis means inflammation. That means the bones around the joint are being inflamed and they're wearing and tearing. There's cervical disc herniation, we talked about that. And that is when the disc is being so overloaded that is causing an irritation. Should this problem continue, don't be surprised having your head forward. People don't wake up with a slouch posture. People don't wake up looking like that. People work their way through it. And our young generation is doing it faster these days than anybody else. So please make a difference. Please share this with other people. I'm just a messenger. I hope I can make a difference in your life. And I'm going to go into the next part, which is the emotional effects, stresses that neck pain causes. It also causes myofascial pain syndrome, also known as fibromyalgia. It can cause the body's immune system so dropped down that it is susceptible to tumors. It can cause spondylolisthesis, which means that the two bones that are sitting on top of each other, they gradually slide without even acute trauma. Now, how do you treat all this? So I told you all the problems. Let's talk about the solutions, okay? All right, so I gotta put my doctor glasses on. Neck pain can be treated at home. So you could use rest, ice, stretches. You can do massage therapy. You could do manipulation through a chiropractor, meditation, exercise. All those are factors that you could take care of. You could even take a nice warm shower and stretch under the shower, or you could have some tools. So I'm going to give you some tools you can buy on Amazon, you can buy from our website, wherever you like. Just take care of yourself. That's what matters, right? All right. So you need some tools to help you when you're working. You need some tools when you're sleeping, and you need some tools to just basically get rid of the pain while you're taking care of other factors. And here we go. If you're suffering from radiating, sharp shooting, stabbing, aching pain that's going down your arm, that means you have a nerve pinch. Nerve pinch responds best to traction, all right? So what are the tools you would need? If you're having a pain that's going down to your shoulder, that's coming from the 5th level of your neck. If you're feeling it in the 2 index finger, that makes the letter like 6, like this, then you're suffering from C6 problem. If it's going down to your finger, which is your ring finger right here, yeah, that's your ring finger. It's been a while. So if your ring finger, this is C7. If it's going to your little finger, it's C8. So these are different levels of your neck and different disc level and nerve levels that are being pinched. So what are the tools you need? You definitely need to have a posture support. So get this. I have it on. It basically retracts your shoulder and stabilizes your back. You need a neck traction device. So I like neck hammock because anybody can use it. It's available on Amazon. You could get it. And it basically tractions you. But please note that it tractions you just like a spring. And when you're done, it drops you. It does not change the curve in your neck, but it's a good start. It's a good start to remove the pressure from the neck. One of the things that you can do to see if you are qualified for neck hammock is just basically when you have neck pain, lift up your head and see if the neck pain goes away. If that goes away, you're compressing the discs and the nerves, so this is going to help you. You need some massage balls, these guys, okay? And you need a resistive band. Why? Because the massage ball, you can use them after the traction. You're going to relax the muscles using these massage balls, okay? And then throughout the day, you're going to put this around behind your neck and do exercises or perform posture exercises to stabilize these middle back muscles so they can stabilize your back, therefore your head doesn't move forward. The neck position is controlled by the muscles that start from the middle of your back. Ladies, it's around your bra line. So the muscles that start from below your scapula or the shoulder blade, that's when they start protecting the position of the neck for its gross movements, right? That's why when you get a stiff neck, you can't move and you have mid-back pain. Now, what if you just have chronic neck pain? If you have chronic neck pain, you want to use something called a chiropractic neck device. So I got one for you here. It's gonna make a little bit loud noise. Sorry. You can even find that from BAX-U. This is the device, okay? What it's beneficial, because of the curve structure, it promotes the curve in the neck. So you look more like that than that, all right? So you would need the massage balls again. So this is for chronic, this is your set for chronic neck pain, all right? Fantastic. And then obviously using ice and heat, you could do it yourself. If you don't have an ice pack, use, just create one. You could use a bag of beans or a frozen meat, just put in the area. If you use a heat pack, take a towel, rinse it, moist it, rinse it, put it in microwave for 2 minutes, wrap another towel and put it on your upper back. Typically chronic neck problems or chronic muscle problems are much better respond much better to heat than they would to ice. Acute responds better to ice. Now, posture supports. There are different types of posture supports out in the market. When you go on Amazon, you're surrounded by beautiful, beautiful images of posture products. Let me tell you, common denominator between your China cheap products are they compress the armpit and they cause more forward head position. So that the more you make it tight, the more forward your head goes. So here is why we recommend BAX-U posture support versus other products. First of all, it gives you freedom of range of motion. So other products, because they compress the armpit, they don't have a freedom of range of motion. Second of all, BAX-U is designed to be soft on the skin. Why? Because it's made from soft, silky material. And that's what it's designed for. So I could show it on me. It's very thin, it's very soft, and I could just comfortably feel it on my skin. It is adjustable, which means that you can take the straps, roll your shoulders back, look up to activate the extensor muscles of the neck, pull and secure your shoulders. And this retracts your shoulders. It has an adjustability around the chest area, so that way if you have a big lunge, you have room to breathe. On top of that, we have university studies from Michigan University School of Industrial Medicine to detect and document the damaging effect of posture and the benefits of wearing the BAX-U posture support. Why did we do this? BAX-U posture support is covered under Flex Spending Account Health Savings Account. In order for us to be approved by the insurance companies as a medical beneficial device, which is an over-the-counter or prescribed, that's why it's covered by your Flex Spending Account, it had to go through rigorous studies. We also conducted a corporate wellness study, which was a 12-week with 53 subjects. 90% responded that they had better posture. 75% responded that their neck, upper back, mid-back discomfort went away. So it is backed by science. It is designed by a chiropractor for patients for a better health. We're not a China cheap company. We are a made in America product specifically for are for a better health. The price point is low enough that anybody can afford it. So hopefully this would be a better choice. And I know that I'm not rich enough to spend money on cheap stuff, so I'd rather get something that is effective, beneficial. The key to this product is that it has to be worn correctly, just like any health product. If you don't wear it correctly, you won't get the same effect that you would want or you would need, right? If you have any problems, contact us. We'll help you, send you videos, and get you all taken care of. So let's talk about sleep. Neck problems. How many of you wake up with stiff neck? How many of you wake up with or have neck pain or trying to find the right pillow or right mattress for the rest of your body? So let's talk about sleep. There's two types of pillows. The pillows that make you feel good, then the pillows that are good for you. So the pillows on this part, whether you want to have feather, down, memory foam, lax foam, hybrid foam, all those are what makes you feel good. It's your personal preference. But what is right for you is really based on the curve of your spine. If you have a forward head carriage, if you have a straight neck, you definitely want to get a pillow that is more like number 2 or number 3 or number 4. 2, 3, and 4, and 6 are specifically designed to help with the curve of your neck. My preference is 2 and 6. That's me. What I recommend for my patients between 2, 3, 4, and 6 is specifically off of what their x-rays show. So if you have an x-ray, ask your doctor. The ones that take 1, 5, and 7 are the people that usually have a good curve. I will tell you, if you are suffering from straight neck, do not get 1, 5, and 7 because they do not change the curve in your neck while you're sleeping. If you want to be efficient and get maximum money for your time, then get a pillow that works in changing your curve for better during the 7 or 6 to 8 hours of your sleep time. And the best recommended time is 7 hours. If you are anything less than 7 hours, you increase the aging process, you increase lack of concentration and affect your cognitive abilities. Human bodies were designed, healthy human bodies, to have 7 hours of sleep. Your choice. Let's talk about ergonomics while you're working. Your work tools are essential to keep your body upright and bring your head upright. Why is that important? Is because your spine carries the nerve structures to your body. Changing and altering and slouching at work, and I know those of you who are telling me, well, I have a stand desk. Watch your posture when you're lost in your work. Tell me what you think, how you're standing. A lot of times most people do that forward head carriage. So be cognizant. If you do have a standing workstation, please make sure that you stand in the morning and sit in the afternoon. Prolonged standing 7 to 8 hours a day at a standing desk will cause varicose veins, will cause restless leg syndrome, will cause hip problems, back problem, and for ladies, it will cause problems with your reproductive organs and your uterus. So be careful, alternate between sitting and standing, make sure you take walks every 5 minutes, 5 minutes for every hour, and then calculate from there, okay? Now, the other topics are not part of today's webinar. I will have follow-up webinars regarding those topics, but let's talk about the neck right now. So what do you need for your work? Your basic home tools are going to be ones that change your posture. So wear a posture support that cognitively and subconsciously affect your posture, right? And make sure you take deep breaths in. And how you breathe is when you have your posture in a proper position, it's so much easier to breathe in. And make sure you have a belly breath. So don't breathe from your chest. Breathe by inhaling into your stomach and exhaling through fully. All right, so now take a deep breath with me. Take a deep breath in. Fill up your stomach. Make that stomach blow out and just fill it up with air. And now exhale by totally emptying your stomach, your lungs, your air pathway, relaxing your shoulders. This is belly breathing, also what's used in yoga and meditation. So practice this type of breathing when you're taking your 5-minute breaks. It's going to help you have much better mental cognition. You work much faster, you have more energy, and you won't be reaching out for that chemically induced energy drinks in the afternoon. So breathing. If you want to look younger and be smarter and work faster, just be better, breathe. All right? It's your God-given right. Now, other factors. If you're using a laptop, make sure you use a stand. If you're using on your phone and your laptop and your desktop, make sure you use something like this device. And the reason being that is because, the reason you do that is because you want to make sure that this device puts your phone as close to your eye level as possible. Now, I like these portable tables, especially if you're working from home. The reason being is it can accommodate if you're in bed, if you're on the coffee table, dining table, or the kitchen counter. So it works with you. How do you want to position your screen? Has to be above your eye level. So let me show you what happens. If you take your hand and you hold it straight, so that way you can see your fingernails, move your hand so that way your fingers, your nail tips are along your forehead. That's where you want to have your screen. Most ergonomists will tell you that it has to be eye level. No, it's not. Because if it's eye level and you have a straight neck, you actually do not do anything to help reduce the damaging effect. By raising your monitor higher, so you actually have to tilt your chin to be parallel with the countertop, will help you promote the curve while you're at work. All right. By the way, that neck hammock looks like this. We have it on our site, so you could get that. It has 2 bungee cables that you could actually use. So we'll give you instructions on it when you get yours. Okay. All right. These are the basic tools you can get. They're affordable. You could get it on our website. You could get it from Amazon, whichever you like, but it's helpful tools. All right. Basic helpful tools. Okay. Now, I think this is the completion of my presentation. Hopefully I met the timeline, and it's every Wednesday, come back, join us. Every Wednesday, I'm committed to have a Wednesday wellness. I provide these webinars for you in order to have a healthier life. My goal is to make a difference in your life so you can play this forward. Our next topic is going to be shoulder pain. What is shoulder pain? Why does it affect us? How does it affect us? And what are we doing? What should we do to take care of it? Or what are the hacks you could do at home? See you next Wednesday. Have a wonderful day, and I'll see you next Wednesday.